National debates, I mean, rage in this country about how to manage the AIDS pandemic, whether or not we've got it under control. Is it government's response? The conversation tends to be between the government and a lot of NGOs and lobby groups. We seldom hear from business. Where's the voice of business?
I think that there's been a lot of debate and a lot of criticism of government by civil society, and that's where possibly the media picks up a lot of the noise. In the past, the private sector has been equally critical of government in its intransigence in respect of moving towards accepted policies and practices in respect of HIV. The voice of business has been one where we have wanted to constructively engage with government and with civil society.
Yeah. Okay. Do we have a grip in this country on HIV and AIDS? I know that a lot was said about the previous administration, denialism, etc., and that with the incumbency of President Zuma, a new health minister, the government's been more forthright in dealing with the HIV problem. But has that led to tangible results in terms of a reduction in infection rates?
There has been some positive starts. I think that the views of the minister and the initiatives that have been undertaken by the minister in terms of the ACT campaign, for example, have been very impressive. But it's early days, and I think that the jury is out as far as whether we're making an impact on the epidemic or not.
Right.
We still have an unimpressive infection rate in South Africa of over 1,000 infections a day, and until we get that under control, we haven't won the battle.
All right, obviously this speaks to business and productivity of labour and the rest of it. This week marked the launch of the HCT visual monitoring and evaluation tool. What is it exactly?
You don't know how well you're doing until you can measure it. And one of the sort of one of the ethoses that exist in the private sector, for example, is that you can't manage what you can't measure. And so an enormous amount of energy and effort and money by the private sector goes into managing HIV. So we've launched the BizWell website, which is a web-based monitoring and evaluation system, which allows companies to submit data to us in terms of what they're doing in support of government's HCT campaign.
Okay, so this is about treatment and probably even prevention. Does it have anything to do with monitoring how many people are out of work because of the disease, the cost to the company?
Monitoring and evaluation in South Africa, and certainly in the business sector, is in its infancy. So we've developed this web-based system simply to collect statistics from the private sector around testing. There has been a culture of reticence within the private sector in relation to HIV. Why? Because companies don't want to release information because they fear that they might be breaching confidentiality. They're worried about investor perceptions of their companies and so on. So the BizWell system is a foundational block on being able to build a much bigger and more effective monitoring and evaluation system that can look at not just your treatment related indicators, but can look at your behavioral indicators, which goes to the question that you've just asked around unemployment, social dislocation, behavioral trends and so on.
I mean, you mentioned the issue of confidentiality, and that's very important because it's constitutionally entrenched. And yet, because of those issues of confidentiality, it's been very difficult to get a real sense of how widespread the pandemic is. Because also within the society, there are issues like stigma, for instance. I think we've overcome a lot of those, but many people don't disclose until the very end.
You're right on the money. I think that we underestimate the power of stigma and discrimination. I don't think we have overcome it. I think that people like to say that we've overcome it. Whether we believe we've overcome it is an entirely different story. You know, there are examples of organizations that have got very progressive workplace programs that still struggle to get people to present themselves early for testing and for treatment.
So the BizWell monitoring and evaluation tool, as it is helping to get a sense of how widespread the problem is in business, if the statistics and the information is not coming through because people are not stepping up and stepping forward to declare, what sort of information are you getting onto this website? Well,
I think that you know, the testing information is probably the data which is most easily obtained. There's a huge repository of information which has been kept by the private sector going back almost a decade now around testing. And so it's more a case of getting companies to agreed to register on the Bizwell website, which is www.bizwell.co.za, and to get the companies to agree internally to release that information. And we've received very positive responses from some of the leading companies in South Africa, such as Anglo Gold, BMW, Standard Bank, BHP Billiton, De Beers. Those sorts of companies which have got very progressive HIV programs have been the first to step up to the plate. And what we're wanting to then do is to consolidate that data and then be able to present it to government.
And how then can government utilize it?
Well, I think that government has taken on a massive task in terms of this HCT campaign, and they need partners. The private sector is a partner in respect to the HCT campaign, and what we're wanting to do is obviously reduce the burden on the public healthcare sector. So if we can help them test, and if we can help them count the numbers in the private sector, then that goes towards the objectives in the HCT campaign.
How are you working with the healthcare institutions, for instance, because that's where the large proportion of testing takes place, and I mean there are lots of debates as to whether testing should be mandatory, etc. in the country, because again a lot of the management of AIDS in South Africa depends on voluntary action and goodwill.
It does. I mean, obviously it requires an individual to present themselves for testing, and that's the biggest key and the biggest problem that we haven't unlocked yet. I think that the approach by business is, one, we work hand in hand with government. If we are doing our own testing, there has to be an entrenched and very clear referral process from someone who's tested positive in a workplace to being referred into a public healthcare institution. Indeed, what we also advocate is that actually the private sector works within public healthcare facilities, which is what we're proposing to do in Mpumalanga, for example. And where we're working with private healthcare providers, the maintenance of high quality standards in respect of testing and treatment is absolutely paramount.
Ultimately, this information is going to enable the government to get a better perspective on how endemic the situation is, and then for them to plan better in terms of the various programs that they pursue. How's it going to help business?
The earlier someone can get tested, the earlier can get that person into treatment. And the earlier can get that person to treatment, the longer that person will live and the longer they will stay productive for. So it's important that the wellness and the health of an employee be maintained and remains intact. And if employers can understand that it might be a longer term investment, but an investment which will indeed give you huge returns on investment, if you can look after that staff member, especially if you're in an industry which is labor intensive and capital intensive at the same time, like mining, then it makes a huge difference for businesses to invest in this.
Just talking about what business can do in terms of monitoring the situation, I mean, I worked in an organization where there was just a period where a lot of people were not coming to work because all of a sudden they had pneumonia, and then we know it ends up quite tragically in the end. But there's almost a sense that the organization needs to step in earlier, and you're saying the individual needs to speak up sooner. But that's the crisis I think we're facing in South Africa, is that productive labor is afflicted by HIV and AIDS, and whatever mechanisms that exist right now in terms of managing and monitoring are not helping to bridge the gap between an emergent labor pool and the existing labor pool.
I think that there's a huge role to be played by leadership in this country, and leadership in all spheres of our country. I think that we've seen good leadership coming out from the presidency and from the Minister of Health, for example. Where we haven't seen, I don't think, good enough leadership is within the private sector itself. Yes, you've got organizations like SEPCOA who push the envelope as far as getting businesses to understand the importance of tackling HIV. But the individual leaders in companies themselves can create a very, very conducive space in which labor themselves can feel comfortable in getting tested and getting access to healthcare services. And so much of it relies and sits on trust. If you don't have trust within your workplace, you're not going to get your employees presenting for testing.
Okay, again, we mentioned the costs of managing HIV and AIDS. There've also been a lot of debates, government saying they can't really afford to roll out antiretroviral treatment en masse, business saying it's the individual's responsibility, medical aid schemes really coming to the party late in the day in terms of creating products that would be catered for people living with HIV. The cost to the economy if we don't manage this pandemic? It's
running into the billions. The cost of sickness and HIV and TB in general is running literally into the billions, and we have an extraordinary burden of HIV on this country. We represent something like 0.7 of the world's population, and we have 17% of the world's HIV cases. So we have 1,000 deaths a day, and we have 1,000 infections a day. So you can do a thumb suck as to what the costs are. I don't think that as business we're necessarily taking the epidemic seriously enough. I just want to correct you on one thing, and I'm not saying that it's purely the individual's responsibility to come forth and take care of themselves. I think businesses have a key role to play in creating conducive environments to making sure that employees feel safe in which they can go and get tested and receive treatment. So I think that there's a multiplicity of layers at which we need to get people to transform their behavior, for example. It starts off with an individual, but then the context and the social environment, the contextual environment and social environment is absolutely key.
Are you in a position to roll out this monitoring and evaluation tool into the rest of the SADC region, for instance, because some of our member states in Southern Africa also have some of the highest infection rates?
This system that we've developed is by no means is it proprietary. We are in early discussions with government in terms of how we can roll the system out into government itself, because I think that what you need is a very simple system by which you can collect information. And so far as offering the system to the rest of Africa, indeed our door would be open for us to have discussions with other business coalitions that exist across the entire African continent in rolling out a system like this.
Okay, there's talk of introducing possibly a national health insurance and then trying to really just coalesce a lot of the functions of financing public health in that system. Would you play a part in this one?
I think we would. I think that we would certainly like to be invited to the table with government in terms of discussing national health insurance. I think one thing that we, in a sense, are in agreement with government on, and that is that if we don't get our infection control and infection rates of HIV under control in South Africa, national health insurance's sustainability will be severely threatened.